Good day everyone, I am Realin PM Plica, your student nurse from BSN12. Today, I will be demonstrating on how to get the vital signs including the pulse rate and respiratory rate on the patient. For the planning, we need to wash our hand to reduce the transmission of microorganisms that will cause us illnesses and diseases. And for the assessment, we need to assist our client and to explain to them the procedure. In identifying the client, it helps us to perform the right procedure to the right client. So in explaining the procedure, it helps us to elevate the fear and anxiety of our client that for participate for client's cooperation. Okay, good day ma'am. I am Realin, your student nurse for today. I would just like verify your information. What is your name?
I'm Retdem.
Okay, ma'am. And your birthday?
September 1, 1971.
Okay, Ma'am Lalibet. So today I will get your vital signs, including your pulse rate and respiratory rate. Is that okay to you, ma'am?
Yes.
So after verify the information of our client, so next let us proceed to gather the equipment that we needed. So the equipment that we needed are the pen and paper for recording, and also the wrist hand. It helps us to avoid the distraction while performing the procedure. So for the implementation, we perform the pulse rate on the patient. So the pulse rate, it is also known as the heartbeat. So now let us count the number of heartbeats of our client. So first, we need to assist our client in sitting position while his arm rests alongside of his body and the wrist extended and the palm facing downwards. So within this position, places the radial artery on the inner aspect of the wrist hand. So next, we will place the tips of our middle three fingertips on the side of the palm of the patient wrist. Then rest the thumb on the back of the patient wrist. So the fingertips are sensitive to touch and we will feel the pulsation of the patient artery. Then we will now apply enough pressure to feel the pulsation. Then pressing too hard may stop the flow of the blood and we will not able to feel the pulse. So next, when we feel the pulse started to beat, we will now use the wrist hand to count the number of the heartbeats. So let us now start. So after record the pulsation of our patient, we will now record the result. So to serve as the baseline data. So I get 68 beats per minute. So 68 is still within the normal range. So next, let us now proceed to the respiratory rate counting. So in respiratory rate counting, we still need our fingertips is in the place as if we're taking her pulse. This way, client is not conscious while breathing is watched. And then note the rise and fall of the client chest with each respiration. So using the wrist hand, we need to record the number of respiration of the client. Okay, now let us now start. So after counting the respiration of the client, we will now record the result. So I get 13 breath per minute of the client. So 13 is still within the normal rate. So after record the pulse rate and respiratory rate, we need to inform our client about the result. So ma'am, your pulse rate is 68 and your respiratory rate is 13. So all of this is still within the normal range. So after doing the perform or taking the pulsation and respiratory rate of our client, we need to wash our hand for infection control measures. So that would be all. Thank you, everyone.